Okay, so picture this. The heart's upper chambers, the atria, they're doing their thing, right? Beating away.
Right, generating the normal electrical signal, trying to set the pace.
But then the signal, the instructions for the lower chambers, the ventricles, it just stops, like hits a complete dead end.
Exactly. It's completely blocked, can't get through at all. It's like the main communication wire's been cut.
And that's what we're diving into today, this condition called complete atrioventricular block.
That's it. Third-degree AV block is another name for it. It's a total breakdown in that electrical communication pathway.
So the atria and ventricles are just completely out of sync.
Totally uncoupled. They beat entirely independently. The atria are doing one thing, the ventricles another.
But wait, if the signal doesn't get through, the ventricles can't just stop pumping, surely. That would be bad.
No, they don't just stop. That's where the heart's backup systems come in. It's
Yeah.
actually quite remarkable.
A backup, how does that work?
Well, when that main signal path is gone, a secondary pacemaker, sort of an emergency one, takes over to make the ventricles beat. We call it an escape pacemaker.
An escape pacemaker, where does that come from?
It can originate from a couple of places, either near the AV junction, the normal connection point that's called idiojunctional, or it can come from lower down, actually within the ventricle muscle itself. That's an idioventricular rhythm.
Okay, so there is a backup, but I guess it's not as good as the main system.
Definitely not. The big consequence is that this escape rhythm is usually much, much slower than the normal heart rate, less efficient.
Right, so you've got the atria potentially beating normally and the ventricles doing their own slower thing, like two drummers playing different beats.
That's a great analogy, and you can actually see this on an ECG, the electrocardiogram.
Yeah, what does that look like? All those squiggly lines must show something weird going on.
Oh, absolutely. One of the key things you see is way more P waves than QRS complexes.
Okay, P waves are the atria, QRS is the ventricles, right?
Exactly. So you'll see the P waves marching along, representing the atria contracting. But the QRS complexes, the ventricle beats, aren't following them in that nice coordinated one-to-one pattern. They're doing their own thing.
Because the signal's blocked.
Precisely. The atrial rate, the P waves, might be perfectly normal, maybe even fast sometimes. But the ventricular rate, the QRS complex is driven by that escape rhythm, is slow.
How slow are we talking?
Well, in dogs, if the escape rhythm is coming from that junction area, the idiojunctional rhythm, it's typically around 40 to 60 beats per minute.
Okay.
But if it's coming from the ventricles themselves, the idioventricular one, it's even slower, usually less than 40 beats per minute.
Wow, less than 40. That's really slow.
It is. Interestingly, cats are a bit different. Their idiojunctional escape rhythm tends to be faster, maybe 60 to 100 beats per minute. Still often slower than their normal rate, though.
And I remember seeing in our notes that the shape of the QRS complex can also tell you something.
Yes, that's another vital clue. It helps pinpoint where that backup pacemaker is located. Okay, so if the escape rhythm starts low down in the ventricles, or maybe in the lower part of the AD junction after the main electrical highway is already split.
Like the bundle branches.
Exactly. If there's a bundle branch block involved too, then the QRS complex often looks, well, the sources say, wide and bizarre.
Wide and bizarre, got it, because the signal's taking an unusual path through the ventricles.
That's the idea.
Yeah.
A longer, less efficient route. But if the escape pacemaker is higher up in the AV junction, before those main branches split, and there isn't a bundle branch block, then the QRS might actually look relatively normal in shape. Narrower.
Okay. But the defining feature, regardless of the QRS shape, is that disconnect, right?
Absolutely. The key diagnostic feature, like our source material emphasizes, is P waves have no constant relationship with QRS complexes. They're independent.
So the timing between P waves is regular, and the timing between the QRS complexes is also regular, but they're not talking to each other.
Exactly that. The PP interval is constant, the RR interval is constant, but there's no fixed PR interval linking them. You just see P waves falling randomly relative to the QRSs.
I think that figures in our sources showed this really clearly.
They did. Figure 1, for instance. You see those P waves zipping along at 120 beats per minute, but the ventricles are just managing 50 beats per minute, completely separate.
And figure 2, the cat example, was even more striking, wasn't it?
Yeah, the atria were firing at a crazy rate, like 240 beats per minute, maybe atrial flutter or tachycardia, but the ventricles stuck down at 48 beats per minute because of the complete block and the slow escape rhythm.
So, okay, the heart's managing to beat, but it's really slow, especially if it's that ventricular escape rhythm below 40.
Yeah.
What does that do to the animal? What are the consequences?
Well, think about it. The ventricles are the main pumps pushing blood out to the body. If they're beating that slowly, they just can't pump enough blood.
So low cardiac output.
Exactly, low cardiac output. And this becomes a major problem when the body needs more oxygen, like during exercise or even just excitement.
The heart can't speed up to meet the demand.
Precisely. The escape rhythm often has a fixed, slow rate and can't really increase much. So the animal tries to run, the muscles scream for oxygen, but the heart just can't deliver.
And that leads to?
That leads to symptoms. And over time, this chronic low output and the inability to respond to demand can cause the heart to fail. Congestive heart failure.
Ah, okay. So you might see signs of heart failure developing.
Yes. And the sources mention that initially, maybe only strenuous activity causes problems, but as things progress, even mild activity can trigger those signs. Difficulty breathing, weakness, fatigue.
It sounds pretty serious. Who tends to get this? Are there, like, particular animals more at risk?
It can happen in both dogs and cats. Breed-wise, for dogs, Cocker Spaniels pop up quite frequently.
Oh, why them specifically?
They seem prone to something called idiopathic fibrosis. Basically, scar tissue forming in the conduction system, including the AV node area, for no clear reason. Just happens.
Huh. Any other breeds?
Our sources also mention pugs and Doberman pinschers, though maybe more in the context of other AV conduction issues and sometimes sudden death related to problems in the bundle of his region.
Okay. And what about age? Is it an older animal thing?
Generally, yes. It's often seen in geriatric animals. The median age for cats mentioned was around 14 years.
14, wow.
But it's important to note it can also be congenital. Some animals are just born with this defect in their heart's wiring.
Right. Born with it or develop it later in life. And I saw a slightly unusual point: intact. Female dogs are more prone.
Yeah, that was an interesting observation in the notes. Intact females seem to have a higher predisposition. The reason why isn't perfectly clear, maybe hormonal influences, but it's noted.
Okay. So if you're a pet owner, what are the signs you might actually notice? What are the sort of red flags?
The big ones are related to that low cardiac output. So exercise intolerance is key. The animal just can't keep up like they used to, gets tired really easily.
Okay, that makes sense.
Then you might see episodes of weakness or even outright fainting, which we call syncope. That happens when the brain doesn't get enough blood flow momentarily because the heart rate is so slow.
Fainting spells. That would be scary.
Definitely. And then, as we talked about, if it progresses, you might start seeing signs of congestive heart failure, maybe coughing, difficulty breathing, sometimes a swollen abdomen.
And what would a veterinarian pick up on examination?
Well, the most obvious finding is usually profound bradycardia, a very slow heart rate.
Slower than expected for the animal size and situation.
Exactly. They might also hear some abnormal heart sounds. Sometimes extra sounds called third or fourth heart sounds can pop up because of the discoordination. And the intensity of the main lub sound, the first heart sound, might vary from beat to beat.
Why would it vary?
It depends on where the atrium contracts relative to the ventricle. If the atrium happens to contract right before the ventricle, the valve is pushed wide open, and when the ventricle slams it shut, it makes a louder sound.
Okay.
If the timing's different, the sound intensity changes.
Fascinating detail.
And of course, they'd look for other signs of CHF if present. But there's one quite specific physical exam finding mentioned.
Oh, yeah. What's that?
These things called Canon A waves. You look at the jugular veins in the neck.
Canon A waves. Sounds dramatic.
It kind of is. Normally you see a little pulse in the jugular vein when the atrium contracts the A wave. But in complete AV block, because the timing is off, sometimes the atrium contracts when the main valve below it, the AV valve, is already closed by the ventricle's contraction.
Ah, so the atrium is pushing against a locked door.
Exactly.
Right.
And that generates a much larger, more forceful wave that you can see bounding back up the jugular vein. That's the Canon A wave. It's a direct result of that atrioventricular dissociation.
Wow. It's amazing how these physical signs reflect that underlying electrical chaos. So what actually causes this block? You mentioned fibrosis in cockers and congenital issues, but what else?
Yeah, there's quite a list, actually. It highlights that this specific electrical problem can stem from many different underlying conditions.
Okay, like what?
Well, besides the idiopathic fibrosis and congenital defects,
Yeah.
you can have infiltrative diseases affecting the heart muscle, things like amyloidosis, where abnormal protein builds up, or even neoplasia, cancer cells infiltrating the heart.
Right?
In cats, hypertrophic cardiomyopathy, a thickening of the heart muscle, can sometimes lead to it. Then there are external factors or other diseases.
Such as?
Digitalis toxicity, that's a heart medication that can cause AV block if the dose is too high. Hyperthyroidism, especially in cats, can sometimes be associated.
Okay. Thyroid issues affecting the heart's electricity.
Yeah. Then inflammation of myocarditis, which is inflammation of the heart muscle itself, or endocarditis, an infection of the heart valves or lining, can damage the conduction system.
Infections. Makes sense.
Electrolyte imbalances are another big one, particularly severe hyperkalemia, that's high potassium, but sometimes low potassium too. Myocardial infarction, a heart attack, although less common perhaps in pets than people, can damage the AV node. Other congenital heart defects can sometimes be linked, and even certain infectious diseases like Lyme disease.
Lyme disease. Really?
Yep. Lyme carditis can cause AV block, and Chagas disease, which is more common in certain geographic areas, caused by a parasite.
That's a really diverse list of causes for the same endpoint, the blocked signal.
It really is. From structural problems to inflammation to toxins to infections to electrolytes, lots of roads can lead to complete AV block.
So with all those possibilities, how do vets confirm it's definitely complete AV block and try to figure out the why?
The ECG is king here. It's usually definitive for diagnosing the block itself, showing those independent atrial and ventricular rhythms.
Right, the P waves and QRSs doing their own thing.
Exactly. But then you need to differentiate it from conditions that might look similar sometimes, like advanced second-degree AV block, where most signals are blocked, but maybe one gets through occasionally, or atrial standstill, where the atria aren't really generating signals properly at all, or even something called accelerated idioventricular rhythm, which is different.
Okay, so ECG sorts out the what. What about the why?
That's where other tests come in. Basic blood work, CBC, biochemistry, urinalysis is crucial. It can pick up electrolyte problems like that high potassium, or show signs of inflammation or infection that might point towards endocarditis.
Checking for underlying systemic issues.
Right. And you might do specific tests based on suspicion, like measuring digoxin levels if toxicity is possible, or Lyme titers if the animal lives in an endemic area.
Makes sense. What about looking at the heart itself?
Echocardiography, the heart ultrasound, is really important. It lets us see the heart structure, look for thickening like an HCM, check valve function, see if there's fluid suggesting heart failure, and just generally assess the overall health of the heart muscle.
Gives you the anatomical picture.
Precisely. And sometimes, for tricky cases, especially if the block seems to come and go, more specialized tests might be used. Things like his bundle electrogram, which involves catheters inside the heart to record signals right from the conduction system.
Wow, it sounds invasive.
It is more specialized. Or Holter monitoring, where the animal wears a portable ECG recorder for 24 hours or more to catch intermittent problems.
Gotcha. And if you were to look at the heart tissue itself, pathologically, what's usually found?
Often, it's what we discussed, degeneration or fibrosis, basically scarring, of the AV node itself and the bundle branches that come off it. These crucial electrical relay points are damaged.
So physical damage to the wiring.
Essentially, yes. And this damage might be isolated, or it could be part of more widespread heart muscle disease, like fibrosis elsewhere in the muscle, or signs of past inflammation.
Okay, so we know what it is, the signs, the causes, how it's diagnosed. The big question then, what's the treatment? Can you fix this broken connection?
Well, fixing the underlying block itself is usually not possible with drugs. Because the signal is completely blocked, medications that try to speed up the heart or improve conduction from the atria just don't work. They can't get the signal across the damaged area.
So drugs are mostly ineffective.
Largely, yes. Our source material is pretty blunt, saying drug treatment is usually of no value for symptomatic complete AV block. Things like atropine or isobutyrenol might be tried, sometimes corticosteroids or dobutamine, but they rarely provide a reliable long-term solution.
What can they do then?
Isoproterenol, given intravenously in an emergency setting, might temporarily increase the rate of that ventricular escape rhythm a bit, which could help stabilize a really unstable patient. But it's not a long-term fix.
So if drugs don't work, what's the answer for animals that are having symptoms like fainting?
The only truly effective treatment for symptomatic patients is a pacemaker, a cardiac pacemaker.
Implanting a device to take over pacing the ventricles?
Exactly. Either a temporary one in an emergency, or more commonly a permanent pacemaker, surgically implanted under the skin with leads going into the heart to directly stimulate the ventricles at an appropriate rate.
That sounds like a major procedure.
It is a specialized procedure, yes.
Yeah.
And before doing it, if the animal is in congestive heart failure, you need to manage that first with drugs like diuretics to get rid of excess fluid and maybe vasodilators to reduce the workload on the heart.
Stabilize them first, then implant the pacemaker.
That's the general approach.
Are there any medications that should definitely be avoided in these animals? things that could make it worse?
Oh, absolutely. This is critical. You need to avoid drugs that can further slow the heart rate or, importantly, suppress that vital escape rhythm.
Because the escape rhythm is the only thing keeping the ventricles going, right?
Precisely. So, drugs to avoid include digoxin, certain sedatives like xylazine and aspirin, beta blockers like propranolol or atenolol, and calcium channel blockers like verapamil or diltiazem. All of these can slow the heart rate or AV conduction.
Okay, that's a key list.
And also, ventricular antiarrhythmic drugs. Drugs meant to treat fast abnormal rhythms originating in the ventricles. You wouldn't want to use those here because they could potentially suppress the escape rhythm, which would be catastrophic.
Right, you need that escape rhythm.
You do.
Oh,
There's also a caution about using vasodilators carefully, especially before a pacemaker is in, as they could potentially drop blood pressure too low in an animal whose heart can't speed up to compensate. Needs careful monitoring.
so let's say an animal gets a pacemaker. What happens next? Is it smooth sailing?
Pacemakers generally work very well and dramatically improve quality of life, but yes, there's ongoing monitoring needed.
Like what?
Regular checkups, definitely. These involve follow-up ECGs to make sure the pacemaker is functioning correctly, capturing the ventricle with each pulse, sensing the heart's underlying rhythm properly if needed. Chest x-rays are also usually done periodically to check the position of the pacemaker generator and the leads.
Making sure everything's still in the right place and working.
Exactly. And there can be potential complications down the line, though they're not overly common with modern devices. Well, the battery will eventually deplete, usually after several years, and the generator needs to be surgically replaced. The device itself could malfunction, though rare. You can get something called exit block, where the heart tissue around the lead becomes scarred and doesn't respond to the pacemaker pulse anymore. Or the leads themselves could move out of position, break, or, uncommonly, get infected.
So it requires lifelong management and checkups.
Yes, it does.
And what about the overall prognosis? What's the long view for an animal with complete AV block?
It really depends on whether they get a pacemaker. For animals with symptoms fainting, severe weakness, heart failure, the long-term prognosis without a pacemaker is generally considered poor. They often don't live very long comfortably.
But with a pacemaker,
With a pacemaker, the outlook can be significantly better. Many animals can live a good quality life for years. It effectively bypasses the block.
that's good news. Though I remember our notes had an interesting point about cats.
Ah, yes. It was mentioned that, somewhat surprisingly, some cats with complete AV block can apparently survive for over a year, even without a pacemaker. They might still have limitations and symptoms, but they seem, in some cases, a bit more tolerant of the slow heart rate than dogs, perhaps. Still, a pacemaker is generally recommended for symptomatic cats, too.
Okay, so wrapping this all up then. Complete AV block. It's a pretty serious electrical failure in the heart, isn't it?
Definitely. That communication line between the atria and ventricles is completely severed. The ventricles have to rely on their own, usually much slower, backup rhythm.
And while lots of different things can cause it, from scar tissue to infections to toxins,
The only truly effective fix for animals struggling with symptoms is usually that implanted pacemaker.
it really is incredible, though, isn't it? That the heart has that backup system. Even when the main control goes down, there's this, emergency generator that kicks in.
It speaks to the resilience of the system. That ability to generate an escape rhythm is life-saving, even if it's not ideal.
It makes you wonder, doesn't it? What other hidden backup plans or fail-safes might be lurking within our bodies, ready to take over when things go critically wrong? It's just mind-bogglingly complex and adaptable.
That's a really great thought to end on. The body's redundancy and resilience are truly amazing. If this whole area of heart electricity, the electrophysiology, or the advances in veterinary cardiology and things like pacemakers has caught your interest, well, there's a huge amount more to explore out there. Always more to learn about these incredible biological machines.